Welcome to Solutions Ahead. You're watching India Ahead. Well, this show is about bringing in all the experts and bringing in answers to the queries that you have been asking us. Of late, we're getting a lot of queries on finding out solutions to leading a healthy lifestyle and also getting solutions for all those people who have been going through certain ups and downs with their health when it comes to disorders and diseases like diabetes, or you can say cardiovascular diseases or arthritis, etc. So I thought, you know what, let me just invite somebody here today who has some very unique things to tell you, not just when it comes to the medical field, but actually treating these kind of disorders and diseases through eating the right food and food extracts. So welcome Dr. Rajat Trehan. He is a PhD in clinical nutrition and an expert in plant-based nutrition. And he has himself suffered from a liver disease, and I think that is where he got his breakthrough to come across something which has changed his life completely. And let's find out more from Dr. Rajat Trehan. Welcome to the show, Dr. Rajat.
Thank you for inviting me here.
Pleasure is all mine. So, सबसे पहले मुझे आप बताइए that how did this start? So, I believe that there was a little story that we were talking about this morning when we met off the set. So, what was all that about?
Actually, I suffered a liver damage, and
when was this?
It was approximately in year 2010 or 11.
अच्छा, काफी साल हो गए.
Yeah, and the doctors gave up, and I was devastated. My life was devastated, and I was actually literally crying. How to treat myself? I want my life back.
Right.
So a thought came to my mind that our body is made up of food.
Correct.
Which we eat.
Right.
We don't. We are not. Our body is not made up of chemicals or the drugs. It is made up of food.
True.
And we need food to maintain our body.
Absolutely.
To grow.
True.
Right. So I find the solution of treating myself through food.
Okay. So you said that I will now take this on myself and I will fix it myself.
Yeah.
Okay. That's a brave decision, by the way.
Yeah.
And then how long did the
and when you don't have any other option
also.
Yeah,
but then the turnaround time, वो फिर कितने time में सब कुछ
7 months.
7 months?
Yes.
You changed it just like that in 7 months?
Yes.
Wow. So then did you go back to your doctor saying that, you know what allopathy couldn't do, I've done it through food?
My brother is a doctor. And he was amazed. Wow.
Okay. So what I mean, I don't want to go into the whole detail of that whole thing, but how did you get there? What did you go through a research and study, and then you incorporated certain things in your diet every day?
I started reading books about plant-based nutrition, and then I treated myself.
Right.
And then I am associated with the education, training and development company called Landmark Education.
Right.
In which I took on the community project. I was actually attending a program called Self-Expression Leadership Program.
Okay.
There I took the community project.
Right.
To make people aware of this.
Okay.
There is a strong relationship between food and health.
Sure. And that's when Heal Your Body came up?
Yeah.
That's 2014.
Yes.
अब काफी साल हो गए.
Yes, and I have treated more than 2,000 patients.
2,000 patients.
Yeah.
So we were just discussing before the show this morning when we were getting a little, comfortable to know each other and discuss about, how Dr. Rajat has been through this journey. So that's when I asked him that at what stage does someone come to you when you say that I'm going to now heal you through food or plant-based food extracts, for example?
Okay. Mainly my patients come to me when they are at the very end stage of their diseases.
Okay, that means they've tried everything, that nothing worked, फिर वो आ गए.
When they have lost hope.
Right.
And there are few people, those who are having unbearable knee pain or joint pains, they also come to me when the painkillers
didn't work.
Their body don't respond to painkillers.
Right.
And they came to me.
And then food was the only answer to that.
Yes, food is the only answer.
Wow. Okay, great. So I just wanted to ask you, Dr. Rajat, that आप किस तरह से किसी को उनका diet जो है वो prescribe करते हो? In the sense, do you add something to it? Do you take out something from it? Do you add more supplements to it? How does that really work with food extracts?
See, food extracts, actually, I don't give it to normal people.
Okay.
Those who can be treated with food.
Correct.
And generally, food extracts are actually required. I am also taking it as I should.
Daily, as you were discussing it with me.
Yeah.
So, talking about diabetes, a lot of people want to know what is diabetes type 2.
Diabetes type 2 is actually the acquired disease. It is the lifestyle disease
It
basically.
is, yes, true.
We as a human being invite diabetes to ourselves.
Is it? Okay.
Yeah.
How does that happen?
Actually, our lifestyle, when
Yes.
we don't go and have active lifestyle, then
Of course.
of course
Yeah.
and we eat lots of simple carbs.
Right.
Right.
So when you say simple carbs, again, can you give some examples?
Processed sugar is simple carb.
Processed sugar. So let's go to processed sugar. अगर processed sugar नहीं consume करना है, then what can one do in place of processed sugar?
There is a desi khan.
Okay, that is healthier. That's a better option.
That's healthier.
And it's available in the market today.
If it is not available, it is available
With you.
us.
Right.
We actually make it.
Oh, fabulous.
Right. And it is made up of beetroot and the sugarcane.
Beetroot and sugarcane. In fact, at the end of the show, I will be sharing Dr. Rajat's email ID as well. So in case you do need to get in touch with him for any of your future requirements when it comes to healing yourself or anybody in the family or somebody you love, then you can do that as well. Okay, so now let's talk about what are the early symptoms. तो कैसे पता चले?
One will feel dry mouth. He will
Okay.
feel thirsty. Frequent urination is
Right.
also. Apart from this, he will be feeling like blood vision and fatigue, lethargic. These are
So
all
at that
things.
time, they should go and get a blood test done.
Yes.
Blood sugar test.
Yes.
Right. And suppose if they come to know that it's a borderline we're looking at, you know, the report shows that, let's say it's a little above that borderline range. What is the first thing that that person has to do then?
See, the thing which people should know is that the limits which they see in the reports are basically the average normal accepted levels.
Okay.
And each human body is unique.
Right.
There might be people, those who are having 130, 140 and they are healthy. They
Right.
might not be having diabetes.
Sure, sure.
Right? That's the accepted level, taking the average of all the people.
Right, right. So tell me something, Dr. Rajat, is high blood sugar level fatal?
Yeah, high blood sugar level is fatal. It can lead to diabetic coma,
Okay.
and even low blood sugar level is also fatal.
All right. What are the
When,
complications there?
See, there are short-term and long-term complications of the diabetes.
Right.
In short term, if the person forgets to take his medicine, his blood sugar level will increase,
Correct.
and it takes more than the required units.
Yeah.
It can lead to low blood sugar level.
Okay.
Long term complications take long time to appear. Actually, increase in the blood sugar for long time actually damages the blood vessels.
So coming back to heal your body, if you can give us a few tips on how to, you know, consume certain foods in the day, certain fruit extracts that you were talking about, plant-based nutrition, and also maybe one or two lifestyle tips. I think that would really help a lot of our viewers.
Food is basically consists of the macronutrients and micronutrients.
Correct.
The macronutrients are proteins. Proteins is the combination of amino acids, and there are 22 amino acids. 9 are essential amino acids which we require, which our body cannot manufacture, right? And then in macronutrients, it's carbohydrates which we are actually as a human being or as the citizen of India, we are taking more simple carbs rather than the complex carb.
So what kind of food does one consume where you can find a few of these, you know, minerals and vitamins? If you can just quickly name 2 or 3 fruits or vegetables.
See, all green leafy vegetables are good for our body.
Okay. So how many can we consume in a day, let's say?
6 to 7 servings.
6 to 7 servings of any 2 or 3 vegetables in a day.
Yeah.
Like for breakfast, you could have methi or palak, ka parantha or
Yeah.
chila.
And you can
something
also
like that?
go for juices,
Okay.
like tori juice,
Okay.
ghee juice,
Okay.
right?
So can tori and ghee juice be mixed, or can it be,
Yes,
or
it
should
can
it be
be
had?
mixed.
Can be mixed. Okay.
Can be mixed.
So certain
And
vegetables,
it will
you
be
know.
better if you put some amla juice also in it, so that it can taste some which is acceptable to you.
Sure. And is it true that when
Eating.
they say that you have diabetes, you should only have Karela juice, bitter gourd juice every morning? Should that person keep continuing to have bitter gourd juice every morning?
Karela juice, ghee juice, tori juice, these are all good for our body.
Is it?
Yes.
Great. So I think juicers are very important in your kitchen.
Vegetable
And
juices particularly.
vegetable juices especially, because the fruit extract, like Dr. Rajat was mentioning some time back, was that you should have the whole fruit along with the skin if possible,
Exactly.
which is very beneficial. So I have a question here from Vikas, who's written to us, who's emailed us in fact from Pune, and his question is that how can one tell what is fresh food in today's day and age, but still at the end of the day the person who's consuming it has some doubts कि ये ठीक है कि नहीं, you know. So what can you tell us in that case?
You asked a very good question. The pesticides are there in the food.
Right.
Exactly, the pesticides there, and it is better to have organic foods, even organic spices also, and you can grow your food in your kitchen garden also. There are many companies which are now providing the organic gardening in the homes.
I think that's a great idea. I've always wanted to have a kitchen garden. So we've got to learn a lot from him today, and would like to really thank you for your time. Thank you for the solutions you've given us, and surely we will have you back on the show soon, where we will talk a little more elaborately on diabetes and other lifestyle disorders and
Sure,
diseases.
sure. Thank you.
Thank you for your time.
Thank you.
Thank you for watching Solutions Ahead. Don't go anywhere. There's more coming up right here on India Ahead.